The name of our presentation is Yoga for Recovery, Decreasing Anxiety in Chemical Dependency Clients. My name is Victoria Cook, and I'm a psychiatric nurse practitioner with over 20 years experience. I'm also the director of the Chemical Dependency Program at Mather Hospital, Northwell Health, located in Port Jefferson, New York.
My name is Denise Driscoll. I'm also a psychiatric nurse practitioner with over 31 years of experience. I'm the Assistant Vice President of Behavioral Health at Mather Hospital, Northwell Health, located in Port Jefferson, New York.
The presenters disclose no conflict of interest with this presentation.
With this project, we were able to reduce clients' self-report of their anxiety by 60% using a non-pharmacologic intervention, yoga. We'd like to take you through the steps to also help you initiate a similar program through your facility. Yoga is both cost-effective and is found to increase patient satisfaction scores. It's an effective intervention that is evidence-based, and it gives clients a tool that they can incorporate into their lifestyle outside of the clinic setting. In assisting patients with recovery, we're often looking for ways, particularly non-pharmacologic ways, to help clients manage their feelings. Yoga is one effective tool to help our clients reach that goal.
People experiencing stress in their life may lack effective coping skills that help prevent the use of harmful risk-related behaviors such as abuse of substances, drugs, and alcohol.
The fallout for some that are unable to use effective coping skills leads to abuse of substances such as drugs and alcohol. The drugs and alcohol decrease feelings of anxiety and other uncomfortable emotions.
Yoga, which was developed over 5,000 years ago in India, was used as a comprehensive system for well-being on every level: physical, mental, emotional, and spiritual. The use of postures, meditation, and pranayama, which is breathing, helps the body naturally heal and balance itself. Used by millions of people all over the world, this helps to raise their quality of life in such diverse areas as fitness, stress relief, wellness, vitality, healing, peace of mind, and spiritual growth. Research findings support the use of yoga in reducing stress-related risk factors and aiding patients' psychological healing processes. Often used in combination with more traditional treatment modalities such as medications and psychotherapy. Some aspects of yoga are subtle and must be acquired through experience. Hence, yoga's time-honored emphasis on the student-teacher relationship, which brings deeper understanding through personal experience.
One of the issues that motivated us to start this program within our facility was the fact that Suffolk County, which is the county in which we're from, has the highest opioid abuse population and the highest opioid overdose deaths within the nation. So it was very important for us to address this issue and set the groundwork for increased non-pharmacologic interventions that patients could use and take with them back into their lives. When Vicki first approached me with this project, my first initial thought was how could we possibly incorporate this within the hospital setting? But we continued to work with our senior management within the hospital and found that it was very possible to accomplish. Some of what we did is included here. We partnered with a nonprofit yoga organization who had been providing yoga to underserved and diverse population, including jails and shelters. So we partnered with them and we contracted with them to provide 8-week sessions by an instructor who was familiar with the recovery process from drugs and alcohol. We worked with our hospital attorney to set up a memo of understanding. Some of the other legal interventions were drafting waivers and releases to cover liability, emergency contact forms, and HIPAA statements for participants and instructors.
We marketed our program through a flyer. It was open to all clients at our facility, and in addition to getting free yoga for 8 weeks, they were also given a free yoga mat.
The goals of the program were simple. We wanted to, again, provide non-pharmacologic interventions for patients to be able to internalize and incorporate within their daily lives. We wanted to assist them in decreasing anxiety felt in early recovery, the ability to learn and to sit with uncomfortable feelings versus having urges and cravings to use drugs and alcohol, to master the power of being present, not focusing on the past or anticipating with anxiety the future. We wanted clients to be able to explore the power of forgiveness and gratitude in their lives and learn how to incorporate this practice on a daily basis. Our hope for them is that this process would allow them to decrease their cravings, therefore decreasing their risk of relapse. And most of all, we wanted to teach clients that this was a process in which they could have fun.
We used a mixed methodology. We asked our clients to participate in the 8-week session and to complete a self-report questionnaire. We pulled one question from the questionnaire, and that question was, in the last month, how often have you felt nervous and stressed? Using a Likert score from never to very often, we compiled the data, and as you can see, clients' self-report of anxiety greatly decreased. We also used qualitative data. Some of our clients' feedback was, I found the Saturday yoga class to be beneficial in managing stress and helping me to focus. It set my tone for the rest of the day. It was a positive start for my day. I hope it can be continued because I felt it was therapeutic in my recovery. Another participant said, I mostly liked the class because I learned to sit with my feelings, and I have a hard time doing that, and that's why I tried to numb them with drugs and alcohol. And lastly, the teacher was great. She wants to become a drug counselor, so she really understands us. The next slide is a video giving you a sample of one of our mindfulness meditations. I'm going to take you through a mini 2-minute meditation. If you are willing, please find a comfortable seat. Your back should be straight but not rigid. Place your hands on your knees. The soles of your feet are touching the floor, grounding, connecting to the earth. You can close your eyes or focus on the ocean, whichever serves you. Breathe normally through your nose. Your inhale should be the same length as your exhale. Relax your shoulders, unhinge your jaw, let your tongue float to the roof of your mouth. Relax your eyes, let your eyeballs float in their sockets. Soften your ears. Imagine a warm light starting at the top of your head as the light moves downward over your face, neck, shoulders, through your back, your sits bones, legs, and finally, through your feet onto the ground. Your body is melting into a deeper, relaxed state. Continue to breathe normally and bring your attention to your breath. Try to focus and listen to the sounds of your breath. As thoughts come into your mind, as they normally will, acknowledge them and let them go without judgment, just like the tide coming in and going out. Each inhalation brings pure, oxygenated air bathing every cell in your body. Each exhale releases toxins and negative energy and thoughts. Continue to breathe. Our meditation is over. Begin to move your fingers and toes and start to bring yourself back to awareness. Namaste.
Because our program was so successful and the feedback from clients was so great, we decided that we would incorporate yoga into our intensive outpatient program for patients recovering from drugs and alcohol. We have a licensed clinical social worker who is already certified by the Yoga Alliance and is currently taking Yoga 12SR, which is a 12-step recovery, a yoga program that is specific to patients who are recovering from drugs and alcohol.
We want to thank you all for attending our session, and please feel free to contact us at the emails below. References are available upon request, and we will also be at the session at Magnet where we can meet with you and answer any and all of your questions, and we look forward to that. Thank you.